Hello, my name is Dedra Teel. I just graduated from North Royalton High School and I'll be attending Case Western Reserve University in the fall. I'm in the Science Internship Program for Nursing. In the summer I worked with Kathy Cerny in the Cardiothoracic Department at Marymount Hospital. And our research was on patient perceptions, quality of life before and after pacemaker implantation. To begin, the human heart is an organ composed of cardiac muscle to pump blood throughout the body. It's composed of 4 chambers, and the heart beats approximately 72 times per minute in a healthy individual. The blood flow is controlled by the sinus node, which sends electrical impulses to the atrioventricular node, where the impulses are slowed down to allow the ventricle to completely fill before pumping out to the rest of the body. Going back to the beginning of pacemakers, the first implantation was done in 1958 with the pacemaker on the left. It was about the size of a shoe polish can, it lasted 3 hours, and it was made with a plutonium battery. Our modern-day pacemakers are now the size of a $50 coin. They last 5 to 11 years and are used with a lithium-ion battery. A pacemaker has 2 components, a pulse generator, which is positioned in a pocket under the clavicle during implantation, and the leads, which are electrical wires that are threaded through the subclavian vein that enter the right atrium and right ventricle. The battery or pulse generator can detect irregular heartbeats and sends appropriate electrical impulses to correct them. The purpose of a pacemaker is to maintain an adequate heart rate, which relieves patients of dizziness, fatigue, weakness, and shortness of breath due to insufficient amount of oxygen in the blood. The purpose of this study was to evaluate the patient's perceptions of their quality of life before and after pacemaker implantation. It was hypothesized that there would be an overall improvement in the quality of life after pacemaker implantation. Also, females would be better able to express the improvement that they noticed. Physical abilities were also being observed in both genders. However, the greatest improvement in physical limitations will be seen in males. For this study, there were 17 patients who were interviewed before and after. These interviews were conducted primarily in person at Marymount. However, follow-up phone calls were also administered. These patients were asked 13 questions regarding their physical and mental health. The questions were based on the quality metric SF12V2 health survey. We had 6 females and 11 males participate, and most of our patients were in their mid-80s. There are many indications for pacemakers. Some include atrial fibrillation, which is irregular electrical impulses from the atria that cause the heart to quiver, bradycardia, when an individual has a resting heart rate of 60 beats per minute or below, for tachycardia, when the heart rate exceeds 100 beats per minute, tachybrady syndrome, when a patient has intermittent fast and slow heart rates, and heart block, which is a condition that affects transmission of impulses through the heart. This chart shows the most common primary indicators for our patients, with the most common being bradycardia. One of the first questions I asked was how the patient would describe their health currently, or in some cases how they would have before they received a pacemaker. From this graph, we can see a standard bell curve, and the females have more spread out responses. On the following graph, we see a more concentrated responses from both of the genders in the very good, good, and fair descriptions. From these results, we saw that 35% of patients felt an improvement in their overall health, 41% remained the same, and 24% had a decline in their description of health. The majority of males and females did not see a decline in their health. We looked at patient physical abilities and how they were affected by their health. We asked about certain activities and if they were limited a lot, a little bit, or not at all. Most patients felt some limitations on vigorous activities like running or lifting heavy objects. Some had issues with moderate activities and stairs and bending and kneeling. When asked again after they received a pacemaker, more people had trouble with vigorous activities. Moderate activities stayed about the same. Climbing stairs they also had more trouble with, and less trouble with bending and kneeling. We found that 18% of patients felt physical activities became easier, 47% stayed the same before and after, and 35% felt an increase in physical limitations. 72% of males had a decrease in physical limitations or remained the same, and this was consistent with our hypothesis. I asked patients to rate their quality of life on a scale of 1 to 10, with 10 being the highest. And from this graph, it's shown that the responses were pretty spread out between 6 and 10. The females, however, are more concentrated in the higher quality of life responses. When asked about after the pacemaker was put in, the responses were found to be higher on the scale in the 7, 8, 9, and 10 range. We found that 35% of patients had an improvement in their quality of life, 47% remained the same, and 18% felt a decline in their quality of life. However, the majority, 82% or higher in both females and males, had an improvement in their quality of life or remained the same. In conclusion, for patients' description of health went from a standard bell curve in the before graph to a more centralized after graph with the very good as the most common response. This is an overall improvement from the before graph that had an emphasis on the good description. We also found that 76% of patients had an increased or maintained the same description of health. Regarding physical limitations, only 18% felt physical activities became easier. However, 47% remained the same. And a difficulty of this study was patients accounting other illnesses and conditions as a part of their physical limitations. In many cases, patients are admitted with another diagnosis and then receive a pacemaker during their stay. For patients' quality of life, over 82% of males and females felt an improvement or stayed the same for their quality of life. This was consistent with the hypothesis only by a small margin, about 1% that females would be higher. And only a fifth of the study population felt their quality of life declined. This is believed because conditions besides heart problems may have influenced patients' responses. It is recommended that this study be repeated with a larger sample population for a longer period of time. The investigation should place a greater emphasis on cardiac conditions to limit outside influences in responses. At this time, I'd like to thank my mentor, Kathy Cerny, and Dr. Donna Waite, as well as the Office of Civic Education, Rosalind Strickland, and Nedra Starling.